This is the Poison Terminator podcast. My name is Carlo Diolan. An article reports that an increase in the number of poison center calls related to cleaners and disinfectants may be associated with COVID-19 cleaning efforts. One of the authors is here to tell us more about the study. My guest is Dr. Diane Calello. Dr. Calello is a medical toxicologist at Rutgers, New Jersey Medical School, and she's also the executive medical director of the New Jersey Poison Center. Welcome to the show, Dr. Calello.
Thanks for having me.
So, Dr. Calello, what were the specific substances involved in these exposures?
So there's a few. The first is kind of general disinfectants, which falls into, the category of anything from brand name Lysol and Clorox to sanitizing wipes, benzalkonium chloride, that kind of thing. In addition to the general disinfectant category, poison centers have noticed an increase in the byproducts of mixing bleach or hypochlorite bleach with other cleansers, which, as we know, when bleach is mixed with something like ammonia, it gives off a toxic chloramine gas. And the calls for both bleach as well as mixing bleach with other chemicals have definitely increased. And then in addition to those two categories, the exposures for hand sanitizers, so alcohol-based hand sanitizers, also went up.
What are the signs and symptoms that are observed after the exposures to the substances that you just mentioned?
So it depends a little bit on the individual substance and the circumstance. So I'll take them in order. The general disinfectant category, the symptoms generally arise from either getting that chemical on your skin, on your face and your eyes, or accidentally getting some by ingestion. So a lot of the calls, fortunately, have a minor effect, but are people who call to say, I believe I've inappropriately washed my produce in a very strong disinfectant. What do I do? It's important to remember that, disinfectants are not cleaners. Cleaners are things like soap and water. Disinfectants are strong industrial chemicals that kill viruses and bacteria. And so when those are ingested, that can cause GI upset. Inhalation of toxic byproducts of mixing bleach causes respiratory distress and wheezing and coughing, and can even land somebody in the hospital. And so that's different because that's something that you breathe in. It's not something that is, eaten or drunk, but the symptoms are from that inhalation and from breathing it in. And then symptoms from alcohol-based hand sanitizers are essentially like being drunk. And although that doesn't sound so bad, it primarily affects young children who will drink a bottle of, hand sanitizer that might be 60 or 70% ethanol because it either has a pleasing color or may even have a pleasing fragrance. And when a 2-year-old drinks a highly concentrated alcohol solution, they can become very intoxicated and can even have instability in their blood sugar. Most of the exposures were mild, but there are some severe exposures in that data set.
And which cleaning chemicals shouldn't be mixed together?
That's a great question. The primary culprits are bleach mixed with ammonia, which generates a toxic gas called chloramine gas, and bleach mixed with vinegar, which generates chlorine gas. Both of those, when they combine with kind of the moisture in your lungs when you breathe it in, form a potent acid in your lungs. So obviously that sounds bad, right? So if you breathe it in and then it kind of converts itself to a strong acid, that can cause a very significant lung injury.
What advice do you have for people using cleaning agents and disinfectants?
I think it's important to know what exactly you're trying to accomplish and on what surface. So everybody right now with COVID-19 is trying to purify their environment as much as they can, and they'll do almost anything to get rid of that virus, which we can't see, but we fear may kill us. But it's important to keep in mind that some things need to be cleaned and other things can be disinfected. Cleaning, like soap and water, is what you do with your skin and your face. It's also what you do with, for example, produce, although it's not recommended to wash that with soap. It's really recommended by CDC to wash that with, rinse that with water and dry it off. That's cleaning. Disinfectant is a strong chemical that is applied to a non-porous surface, like a countertop or a metal surface. And that is to kill any surface bacteria or viruses, or at least inhibit them. And so disinfectant doesn't belong on your skin. It doesn't belong in your food. It certainly doesn't belong anywhere near your eyes. And if you kind of keep those principles in mind, you can stay out of trouble.
Are cleaning products and disinfectants that are eco-friendly less toxic than those that are not?
It depends on the product. Many times they might be less dilute or may contain a chemical like vinegar compared to ammonia, for example, which may be a little bit more easily tolerated, but they still don't belong on the skin if they're not intended to clean the skin, and they certainly do not belong ingested in any form.
Do you think that the labels on domestic chemical products contain all the necessary informations for users of these products?
Well, I think that sometimes people call the Poison Center to get more information, and the information they're generally looking for is the ingredients. And some products are better than others about listing the ingredients, you know, and so not every label contains everything you need. The other thing that people often want to know, particularly if they're a little more savvy, is the concentration. So, you know, is that bleach more like a household bleach, which is required to be dilute, you know, 2 or 3%, or is it industrial bleach, which can be a very dangerous chemical in 30 or 40% concentration? That's a piece of information that not everybody knows to look for, and a lot of times results in a call to the Poison Center. But if you are concerned that you have a concentrated chemical on your hands that is for an industrial application, you should probably be calling the Poison Control Center anyway to determine what the effects are going to be and what advice you need. So I guess the answer is yes and no. You know, some labels are better than others, and it depends on the substance. Is
the Poison Center number listed on all domestic chemical products sold in the U.S.?
I believe it is. If not, it certainly should be. You know, the U.S. Poison Center numbers connect all of the 55 centers. We have one hotline, as you know, which is our 800-222-1222 number. And that number is on many of the chemicals, although it may not be universal.
Can you talk about the New Jersey Poison Center COVID-19 helpline?
Sure. I'm sitting here in it. So the New Jersey Poison Center is the state's only poison center. We serve a population of 9,000 people. 9 million people. And we normally take between 50 and 55,000 call cases a year of people who are concerned about poison exposure. That amounts to a daily volume of about 150 calls a day. I'll tell you why I'm telling you that in a minute. So back in January, when the specter of COVID-19 first came to the United States, I was talking with my managing director, Bruce Ruck, and I said, this virus is going to cause a lot of questions, and I think it's going to get ugly, quote unquote. And I think that the residents of New Jersey are going to need a hotline that they can call and ask questions. And because we're the only hotline in New Jersey that is readily staffed 24/7 with healthcare professionals in a medical capacity, there is a behavioral health hotline. But because we were already operational as a 24/7 hotline, we offered our services to the New Jersey Department of Health. And they very eagerly accepted our help. And we have partnered with them on many occasions. We value that relationship very much. So when we started that, it was January 27th. And I told you we take about 150 calls a day normally. For the first week or so, we took 20 or 30 extra calls a day. And we felt it. We could kind of feel the hotline felt a little busier. Our real-time GIS map had a few more dots on it. You could see that change. Then we experienced a lull of about a week or two, maybe a little longer. And I think that's when COVID-19 still was in the single digits as number of cases in the US. And so we thought, all right, not so bad. And then the US got more cases. COVID-19 came to the East Coast. It came to New York and then New Jersey, obviously with a vengeance. And that extra 20 to 30 calls a day became like 800 calls a day. And all of a sudden our call volume quadrupled or even quintupled. And so that has been our full-time round-the-clock job since, I would say, the mid-February. We've been assisted by volunteers throughout Rutgers as well as throughout the state and the Office of Emergency Management. We now, instead of having 4 or 5 people answer the phone a day, we have closer to 15 people answering the phone. I'm glad to say, I think we're still operational and providing that service. And we are definitely aware, as are all the frontline healthcare providers, that we are in a marathon, not a sprint. If you told me we would be doing this on May 4th, I would have had trouble believing it back in early February. But we're still taking quite a lot of calls from New Jersey about COVID, and I don't think that's going to slow down anytime soon.
And what kind of information people can get from this hotline?
So we are advertised the healthcare provider hotline. We are partnered with a hotline called New Jersey 211, which is the Disaster Preparedness Office of Emergency Management hotline that helps people find things like resources, whether it's supplies in a hurricane, or it's now how to apply for unemployment, homelessness, also testing site location and logistics. So our 211 partners are doing anything that kind of doesn't require medical advice. We are getting a fair amount of those calls here at NJ PIES as well. That's the name of our poison center, the New Jersey Poison Information and Education System. So we are getting a fair amount of those calls here at New Jersey Poison as well. But what people are calling us for that they need is, I think I have symptoms of coronavirus. Should I go to the hospital? Should I get tested? How do I get tested? How do I safely isolate from a sick family member who has COVID-19? When is it safe for me to return to work? I heard that someone in my office has COVID-19. Do I need to quarantine, or what do I need to do? And then we get a lot of calls about safety, like, is it okay to get my mail? Or should I stop my newspaper delivery? Or how can I safely disinfect my groceries? So it is stuff where you kind of need to talk to somebody with a healthcare background. And we have also found that in this time of COVID-19, people just like talking to other people and getting some advice. And a lot of what we're doing is that. Our call times are longer than our usual poison calls, which are, 3, 4, 5 minutes. We are on the phone longer with our COVID-19 calls, and I think it's because people have so many questions and concerns.
Okay, Dr. Calello, thank you so much for giving us some time to answer our question.
Well, thanks so much for having me and letting me talk about, like I said, what has kind of taken over my life in our operation here. And I'm glad to talk about the dangers and the pitfalls of disinfectants as we all try to keep ourselves and our homes safe. Just remember to keep things up and away and out of sight and try to use them as directed. And if you have any questions, you can always call the Poison Control Center and we can help you figure out how to use them safely.
That was Dr. Diane Calello of the New Jersey Poison Center. If you have any comments or suggestions, please write to us at tptpodcast@mail.com. That's tptpodcast@mail.com. Thank you for listening. I'm the Poison Terminator, and I'll be back soon with another episode. Have a great day.